So good morning, everyone. My name is Beth Holmes. I'm looking through the names here. I know many of you, but not all of you. So today we're going to be talking about Hint Connect. And so hopefully you're in the right webinar talking about Hint Connect, both what it is, how to join, and how to leverage it to work with larger employers. So if people want to introduce themselves in the chat section, that would be great. If not, no worries. We could go through this as is. I will start by introducing myself and my colleagues. I'm the head of network development here at Hint Health. My role is to connect businesses with DPCs who want to work with businesses. And I do that sometimes through matchmaking, sometimes through helping DPCs learn how to work with employers, and then very frequently through our new offering called Hint Connect. So I'm joined here today by Lauren Tancredi, who is our practice development manager here at Hint Health. She is in charge of our DPC accelerator and is a really awesome resource for those of you looking to grow your practice and work with employers. Lauren, do you want to give a quick hello and introduction?
Hey everyone, some of you I also have met and talked to. I, as Beth mentioned, run the DPC Accelerator. I've been working in the private pay medicine space for over a decade now. So really helping folks launch, grow, and expand their practice, and excited to share a couple of employer resources we put together for you all to set you up for success. More on the small business side, but that will weigh into what we've got going on here for you today.
Thanks, Lauren. I'm also joined by my colleague, Ji Xiao. She's our senior manager of network development here at Hint Health, and many of you may know her because she's in charge of kind of processing all the contracting and onboarding for practices in Hint Connect. Ji, do you want to give a hello?
There we go. Sorry. Hi, everyone. Good morning and good afternoon. Looking forward to chatting with those of you that are interested in Hint Connect.
Okay. Gian, it looks like Sunia let us know that chat is disabled. So if we can enable that, that would be great. And if not, we'll just take questions through Q&A.
Sounds good. Let me take a look.
And then finally, we are joined by Dr. Jonathan Bushman, who's the owner and practicing DPC physician at Reliant Direct Primary Care in Enid, Oklahoma, and both a part of Hint Connect and using Hint Connect to work with employers. So thanks for joining us, Dr. Bushman. Do you want to say hello?
Sure. Thanks for having me. Appreciate the invite, and looking forward to the discussion. I know it's new to the world of Hint and new to the world of DPC, so a lot of interesting questions that even we're exploring ourselves. So I've been independent in DPC now for a little over 3.5 years. Had a full patient panel for about a year and a half, and we have a group of 5 providers within 3 different locations here in Oklahoma, all rural, all small, and it's working. So thanks for having me.
All right, great. So I'm going to share my screen now. We have some slides that I'll go through, and I will be sharing these after the presentation. Can I get a thumbs up from the panelists that you can see my slides? Okay, great. So, looking at who registered for the webinar today, we think there's kind of a wide swath of people. Some of you may already have a large understanding of what Hint Connect is. Some of you, I think, are new to the product. So we're going to just go through from the beginning and spend about 10 minutes talking about what Hint Connect is, why Hint started it, and how to join Hint Connect if you're interested in joining as a DPC practice. And then we're going to go into a conversation after that with Dr. Bushman about how DPC practices who are working with employers can use Hint Connect for their own practices to land larger employers. After that, we'll have time for Q&A. And it looks like we have Q&A working now. So if you have questions throughout the presentation, please put them in the chat. You can message either everyone or my colleague G directly if you don't want your question to be public to everyone. And G will kind of sift through the questions and help prioritize them at the end. Hello to everyone who's joined. It looks like we have about 33 people here. That's great. All right, so what is Hint Connect? Well, here at Hint, we are obviously the billing and enrollment platform for DPCs, and we've kind of followed DPCs as they have grown. And we started off as a retail platform and quickly saw that DPCs wanted to work with small businesses in their communities to gain membership and grow, but also to kind of service the small businesses in their communities that didn't have great benefits options, and people who had insurance but maybe were underinsured or couldn't afford their copays and deductibles. So what we've seen is really amazing growth of DPCs working with employers. On our platform, actually, more than half of the lives that run through Hint OS are employer sponsored now, and over 40% of DPCs on Hint OS are working with employers. What we saw when we looked at the data and kind of lifted up the hood was that when it's a one-to-one, the relationships are taking off. When it's one employer and one DPC in the community, DPCs are having a ton of success selling, it's working really well, employers can implement it. But when you get to this point when an employer has to work with more than one DPC, that's when things kind of fall apart, because employers are, usually whoever's running HR at an employer wears a lot of different hats. They're doing a lot of different things. And when it becomes too complicated for them to administer a benefit, they're just not going to go with it, even if they believe in the benefit. And on the flip side, I talked to a lot of DPCs who were trying to land larger employer deals, but weren't in the position where they wanted to build their own network and go out and get their own affiliates. And they didn't have the resources to kind of work that long multi-year employer sales cycle. So that's where Hint Connect comes in. So Hint Connect is a layer between the large businesses and multiple DPCs that can help serve large employers or small to medium-sized employers that are spread out in multiple locations. There are kind of, when you look at how businesses are set up these days, whether it's a manufacturing company that has multiple plants or plants and then distribution centers, or a tech company that has everyone working remotely in many different areas, it can be really difficult for one DPC to serve an employer that is very large or spread out. So Hint Connect, we'll go into kind of what exactly Hint Connect is, but that was the genesis behind Hint Connect, just really opening up DPC for employers, mostly over the 25 to 50 lives, and helping DPCs grow through employers if they want to. And I do apologize for these icons of the doctors. They look very serious. I know most of you are absolutely not that serious. So it was the best I could do with the software we had to make these slides. This is a little bit of data from our DPC trends report. And I hope most of you have heard of the DPC trends report or downloaded it. After this webinar, we will send out a link so you can download it if you don't have it already. But our team kind of looked at the data this year, and what we saw was that we have over 4,000 employer sponsors on Hint OS working with DPC practices, and that's both pure DPC and hybrid. Most of our clients are pure DPC. When you look at the numbers of the size of the companies, though, over 75% have fewer than 24 sponsored members. So they're really small. Again, this goes back to the kind of the ease of working on a one-on-one relationship. What Hint Connect doesn't want to disturb those relationships that you have with businesses in your communities. Those are working really well. We see them growing. That's not really what Hint Connect's kind of best function or use is. We really want to help DPCs implement the kind of the 50 and above employers. Another reason that this is important is that Most DPC, they say, average DPC panel is 600. We see a wide variation at HINT. We see some DPCs that are perfectly happy having 300, some that are pushing 800 with use of PAs or NPs or other staff in their office. But, once you're working with an employer and you're getting over 50 lives, you have a lot of your panel with one employer, and that, you become highly leveraged with them. So HINT Connect is also a way for you to work with businesses in your community and kind of spread out that risk. If the employer were ever to end a contract or lose a lot of employees at once, it would be less of an impact to your business because that membership's a little bit more spread out for the larger employers. We also see that DPCs that are part of a network. So some of the network names that you may know now are Nextera, Primary Health Partners, Persona in Florida, Strata. Those DPCs that are affiliates of those networks and have agreed to accept membership from those networks when they work with large employers are growing at a much faster rate than those who don't. And there are probably other factors that go into this. For DPCs who want to work with affiliates, they may be more growth minded. They may be working with employers themselves and kind of set up for that. But growth is kind of one of the biggest challenges and questions that we hear from our DPCs through the accelerator. We unfortunately see practices that, start up, they have everything together, they join HINT, and they just can't get to the next level. And the doctors go back to practicing fee-for-service or leave medicine altogether. And that to us is the worst case scenario because you have someone who's bought into the idea, who's taken a risk, who's kind of serving their community, and they can't get their business off the ground. And it's hard to be a small business owner in addition to a practicing clinician. So we realize that not every DPC is going to want to work with employers, and that we totally respect that. That's totally fine. But for those who do, it's a really good way to grow your practice. And the data show that DPCs who work with affiliates, work with networks, work with employers, grow faster and can establish that baseline membership for their practice. What HINT Connect is, HINT Connect is a middle layer between DPCs and employers. And I know this community is really sensitive to the addition of middlemen and middle women. And, the way that we view it is, it's okay to be in the middle if you know what your value is and you're expressing that value and people agree with it and you're charging fairly for that value. So this is the long and short of kind of what the value is for employers and what the value is for DPCs. So for employers, we are finding contracting direct primary care practices. We're educating and communicating with employees about the DPC benefit. We're administering the benefit through our software, enrollment, eligibility, invoicing, and payment. For those of you who are clients, you hopefully know and at least like all of our functionality. And we're providing reporting, not through claims, via EMR data on the back end for certain EMRs. And for DPCs, we're increasing membership with no additional marketing costs for DPCs. We're letting DPCs access employer deals through a single contract rather than multiple contracts. And we're promoting you through HINT Health marketing channels. So for this, we're charging between $2 and $3 PMPM, and that fee is added to the DPC fee. It doesn't come out of your fee, and we charge that to the plan sponsor, whoever's paying for the DPC. So we just want to be really clear about that and kind of what our role is and what our cost is in the middle. Our goal is to have a national footprint, and this reflects, again, the spread out nature of businesses and really the need that we're seeing from employers to have the network in place before they contract with us. So we talk a lot about supply and demand, what comes first, businesses wanting DPCs and then them starting up, or the DPCs being there and businesses tapping in. Well, what we see is it's absolutely the latter. the supply has to be there. It has to be verified. It has to be that employers can't take a risk that they're going to change their benefit structure, offer a new benefit to their employees, and then when it comes time to sign up, there's nothing there, or the DPC is not taking members. So there needs to be that verified supply of DPC practices in place. And so we're working really hard. G is working to contract over 120 new locations for this year. And then next year, the plan is to expand into the states that are shaded in light blue. This kind of will come into play, I think, a little bit when Dr. Bushman and I talk later down the line, because as DPCs are working with larger employers themselves and trying to, serve employers that may have families that live outside their catchment area, most DPCs know they can call other DPCs and help them service that relationship. But what Hint Connect can allow you to do is kind of look immediately and say, yes, I know there's a DPC there who wants to take lives. I know their price. And I can guarantee you, employer, that they're going to work with you. My colleague G is going to give you a break from hearing me and present the next couple of slides. For those of you who may be interested in joining Hint Connect, there's a little bit more information here.
Thank you, Beth, for that thorough overview. I'm really excited to take you all through some of the key Hint Connect benefits to clinicians. So the first thing is we want to ensure Hint Connect respects your autonomy. So as a result, we will not be dictating how much you should be getting paid from the employer. We trust that you know your services and geography the best. So instead, we just ask you put your best foot forward, so you're more likely to be chosen by an employer. Second, we also understand some clinicians want to actively risk manage their panel, so they may want to limit how many members are coming from one source. During onboarding, you can let us know how many Hint Connect members you're willing to receive from us. We'll get you configured correctly. This is going to be a non-exclusive arrangement, meaning we welcome you to still join or participate in other networks and business opportunities to grow your practice. We don't want to get in the way of that. As Beth has mentioned, clinicians join Hint Connect for free. We won't be charging you a fee to opt into our DPC network, and 100% of that employer membership fee you set forth will go to you if you are selected during open enrollment. Beth has touched upon this earlier. What we will do behind the scenes is to work on your behalf to contract with larger employers so you can focus on providing high quality care. And you'll hear more about this during the latter portion of the presentation, but this is definitely a great way to meet other clinicians, either in your local community or outside of your familiar geography, right? We want to foster the interconnectivity of this growing ecosystem as much as we can. Last but not least, we do not require clinicians to be using HintOS in order to join Hint Connect. So if you or any of your colleagues are interested but didn't want to switch your DPC administration platform, that's not a problem. Feel free to reach out and we'll get in touch. On the next slide, we have outlined a few simple steps. What we'll do is, after this webinar, follow up via email. If you're interested in joining, I will send you our participation agreement, and you can finalize that via HelloSign. Once we receive the completed agreement, I will send you an onboarding spreadsheet where I collect information from your bio, education, right, panel capacity, all of that good stuff, so we can properly configure your profile on Hint, and then we'll get you connected. So feel free to email networkdev@hint.com, and you can also schedule a one-on-one meeting directly by using this link. We will be sending this out after the webinar. Thanks, Beth.
Thanks, Jake.
Back to you.
And I'm going to go ahead and make G's life a little bit harder now, and just let for those of you who may be considering joining and are kind of wary of signing a contract or having to agree to things that you're not comfortable with. First of all, we encourage you to read the contract from tip to tail, understand what's in it, where, we want this to be you to enter in with eyes wide open, what's going on. And we welcome all questions on the contract. We'll work through them with every single doctor. And we can make modifications that still allow us to serve the employers. So, we've had a lot of contract feedback that, we've worked through and gotten to a place that makes sense for Hint Connect and for the doctor. So this isn't set in stone. This isn't like an insurance company coming to you saying, like, take it or leave it. This is the start of a discussion. Sorry, G. Might have given you a little bit more work there, but it's the case. So
no worries.
Okay, so for the final part of the webinar, we're going to go into kind of how DPCs can help, how Hint Connect can help DPCs work with larger employers. So we know, DPCs are 40% of DPCs on HintOS are working with employers. There's over 4,000 employers working with DPCs. And what we've heard from a lot of DPCs is that they've had to turn away or say no to employers that have employees outside of their catchment area. And so there's another way, rather than Hint Connect working directly with employers, that Hint Connect can support DPC growth. And that's through adding a DPC kind of in the chain here that's working directly with the employer. So in this case, a DPC, like say Reliant DPC, would go out, work with an employer in their area, kind of do all that business development, do the relationship management. And they might say, well, I have, 5 employees in Chicago, 6 in Dallas, and 7 in the Rio Grande Valley. So if I can't roll it out to everybody, I'm just not going to do this. What the DPC can then do is use Hint Connect as an extension of their practice, and load the providers into their Hint account for that employer in particular, in order to service that account. And in this case, Hint Connect charges a $2 PMPM fee on top of the DPC fee. We will work with you to make sure that the DPCs fit your criteria. You may not want to work with advanced practice nurses or PAs. You may not want to work with DPCs above a certain price. You may not want to add anyone from Hint Connect who's already in your area, just out of state. So G and I can help configure which practices in Hint Connect that would be right for you as you're working to serve larger employers. So we're really excited now to talk to Dr. Bushman. John, you decided that Hint Connect would be right for your practice to help you grow and land larger employers. So can you talk to us just a little bit more about kind of what your practice does, how you work with employers, and why you thought Hint Connect might be a good resource for you?
Yes, and again, thanks, Beth, for the introduction and having me today. So Hint Connect is an exciting thing for me because I had 2 specific local employers. I'm in a community of about 50,000. As I mentioned, we have a couple other locations, and those are very small communities. One is a community of 1,300 people with a panel, the providers panel there is almost 500. And then a new practice that's in a community of 3,500. They've been in practice for just a few months with a few hundred patients. So, and we cover a fairly general region in Northwest Oklahoma. I have an HVAC company and plumbing company that I serve that has employees in metropolitan Oklahoma City. And they felt like, and we did enter an agreement here locally, but they felt like their 5 employees, which isn't a lot, but it is part of their employment in Oklahoma City, wasn't covered. And can we do this effectively, in one single agreement? And I knew this was coming. I knew we'd had discussions about Hint Health coming. And so that's kind of, it's now possible to service those additional individuals with providers in Oklahoma City. And while these providers are friends and colleagues locally, business-wise, this is the easiest integration between our 2 practices. without having other business affiliations.
I think that when, starting a network can be really appealing to a lot of DPCs, but I think one thing that they, once you get into it, there's a lot of legal and administrative costs associated with it. Usually it's pretty expensive to add on each affiliate, and then going into different states requires new legal language, and it's very administratively time consuming to make the calls and find the affiliate. So that's something that comes already done with the Hint Connect.
And Beth, you and I probably have talked 2 or 3, 4 different times over the last 2 years about, I have these aspirations, ideas about, I would love to go after certain employers, but those conversations, as you mentioned earlier in the webinar, they kind of dried up pretty quickly because there were other locations, and the employer just didn't feel right about offering something locally without offering it to their entire employment. And I have, my largest employer is only locally serviced. I have 2 other locations, and there's not a DPC handy, close. And so that's, that's a matter of time and development. And I think we'll get there. So that solution wasn't entirely possible, even with Hint Connect. But I have an employer that just contacted me last week, who said, I wasn't really interested in doing this just with the one location, but do you know Dr. So-and-so in this other community? I said, yeah, I just talked to her last week. And in fact, I told her about Hint Connect and how we could function as one. And he's like, that's all I need to know. If I can take care of all of my employees in both locations, then let's go forward. Let's do this. And so that was, that was a conversation that took place a year ago that came full circle. This year, having Hint Connect as that additional piece was really all he needed to make the decision to go forward and say, all right, let's do this.
Yeah, that's great to hear. So I noticed that on your website, you say 3 Oklahoma locations in a nationwide network. Is that nationwide network Hint Connect?
For sure, yeah.
And do you feel like that branding has helped you, or have people noticed that kind of change in the way that you're marketing yourself?
That's a great question. This is actually a fairly renovated website, like just a couple, maybe 6-8 weeks ago. So I haven't had anybody specifically ask me that, but I do know that employer that I just mentioned had gone on and was looking and noticed this, right? So I think that's probably where that question came from, was like, hey, what can you do now? Who can you service now? Yeah. And again, there's plenty of employers I've had previous conversations with that I haven't even gone back to yet, but now I'm a lot more comfortable going back to them saying, hey, by the way, there is a solution for servicing your multiple locations in our state and even in the states that surround us. And part of that, as you've mentioned, Beth, I'm going to plug this a little bit, but if we even have a census data and the zip codes for, where these folks exist, where these employees exist, as I understand it, it can help kind of determine how many people we can cover in what geographic location and what radius from the various different DPC clinics.
Yeah, and that's actually something that we're happy to do, whether you're a client yet or not. If you're working with an employer that has a spread out geography and you want to send a census file to me or G, we can run it through our software, and we have a very comprehensive map of DPCs and let you know kind of what the coverage is, and then also work with you on kind of, a lot of practices tend to come back, and then we narrow it down and say, what are the ones that you'd actually want to work with for this opportunity, and are they in Hint Connect, or can we get them in Hint Connect to service this opportunity? So it's usually a multi-step conversation where we kind of start broad and then get down to nuts and bolts. And we just went through this with a prospect in Colorado who wanted an additional location in Florida. One location in the area was contracted. We went to the other one based on the feedback from the prospect, and had that conversation. They're interested in joining. So we are an extension of your team and really want to help you grow. Our mission is, we're a DPC company. Our mission is to see DPC grow, and we think that I kind of have a narrow lens because my role is working with employers. There are a lot of other people at Hint who help practices grow on the retail side, but I think this is a great way for practices who have found that working with businesses is right for them. John, are there? Oh, go ahead.
I was going to say, you mentioned before we, for me specifically, being in a rather smaller community, smaller practice sizes, I don't have a major metropolitan area to really draw from for building my own affiliate network. And that was something that I had contemplated a long time. And it was the investment. It was costly. It was time consuming. So obviously I was really excited when you first unveiled Hint Connect to me. I was like, this is exactly what I need, because this takes all that legwork, the cost, the time, the legal, the everything else that I was worried about, whether or not to pursue. It took that off the table for me. And at $2 a month, it actually covered by the sponsor. Like, it's absolutely no financial burden for me to participate, which is probably the best part.
Yeah, and to add, we don't have a minimum number of lives that you need to, we're calling it Rent Hint Connect. That's a very insurance-y way to say it, but essentially use Hint Connect as an affiliate, an extension of your practice. If you want to send one patient in a different area through Hint Connect, we will help enable that. And that'll be $2 on that PMPM on that life. So there's no minimum. We are just hoping that this is a good tool for DPCs who are working with employers. John, do you have any concerns or questions about Hint Connect, or anything that kind of went through that you had to work out as you decided to participate?
For me, it was fairly seamless, and G, I'm going to put you on the spot, even though it was me that was the problem. But I delayed getting my signature to you. That was probably the only holdup, was just on my end, because otherwise it was a really simple process. To just after we did the initial call and discovery and discussion, yeah, the form was very easy to sign and execute. So no, I thought it was very easy, very straightforward, in a lot of ways, because like I mentioned, I wanted this for so long. It was kind of almost too good to be true. Like, okay, here we go. There's the solution. Thank you for doing this, because I'd wanted that for a long time.
That's great. Awesome. So I think, at this point, I'd love to open it up to questions that we have gotten in the chat. Looks like it's been pretty active, and G, you've probably gotten some direct questions. So
yeah,
do you want to just kind of start listing them off and we'll go through them?
sure. We have a question from Dr. Rimmer. He's asking, are there plans to have a list of practices participating in Hint Connect so we can see the areas that are being served when having these conversations with employers?
Yeah, that's a great idea. I think, we've grown a lot in the past 8 months. So 8 months ago, I think we had maybe 1 or 2 practices, and now we have over 70 locations. I think it might be over 80 this week. And I think it's just about time that we kind of create a map. So hopefully we'll have an externally facing map sometime soon. But for if you are actively having these conversations, you can reach out to me and G, and we can provide you a list of practices at the time to support your discussions.
And we also have another question from Sunil. How many members? Oh, I think I might have missed the first part of his question. How many members these practices can accept? I think in general, we are collecting that during onboarding, but we can do that through our geoanalysis for you and let you know if we need to contract with additional practices in order to support that employer. We have a question from Dr. Moore. How many potential patients does Hint have for Amarillo, Texas?
I would say right now things are in flux. We had an opportunity in Texas earlier this year, and they are doing a pilot in a different part of Texas. But we are always looking for having constant discussions with employers, other DPCs. So I don't know of any right at this moment, but I know, Dr. Moore, you're kind of the game in town in Amarillo. So when we do have practices or potential employers, they would probably be serviced by you if that's something that you'd want.
Those are all the questions I think so far.
Okay, great.
I was going to say too, Beth, and I noticed Sunil's on the webinar, and we met last week and met you as well, Beth. And I think a big thing too that I'm recognizing when I mentioned this to local brokers or even health advisors, it's a new thing for them too, and so they're having to understand that this now exists. And I would suggest to the DPC physicians on the call, make sure your local brokers are the people that you partner with that are kind of on the front line selling DPC as a centric part of an employer health plan, that they also know about Hint Connect and how it works, because we all play together and we all play nicely. So I think it's really important that those brokers and advisors know that, because it gives them more ammunition to sell DPC to employers with multiple locations.
And things have changed really quickly. You know, I've had conversations for the last 3 years with advisors, and you know, it was at the Health Rosetta Summit last week, and I've had a couple conversations where they were like, oh, we know what you do, you're DPC technology, you know, we're not interested in building our own network. And I have to reframe the conversation and say, no, we've listened to your feedback. We have an easier way to implement DPC, and we're in 21 states, we're really out there. So yeah, I think anything to help spread the word would be great. And we got a similar question here from Dr. Yerkes. What are we doing to spread the word? So we are working directly with brokers. We're working with TPAs who have their own offering. We're working with DPCs, and we're starting to think about how we can create materials that help DPCs and brokers really sell a DPC offering. So that's next on our roadmap, because we know that, leveraging our whole community to bring the message out to employers is really important. Other things on the table include partnering with cost sharing entities, and we're thinking about direct to employer, direct to consumer marketing, but we're not quite there yet.
Beth, we have another question from Dr. Alejandro. What are the legally permissible arrangements you can make with brokers that are not violating any laws?
I think that question probably has to do with the Stark Law and kind of the ability to pay commissions. Right now, we're not paying commissions to sell Hint Connect. If a broker wants to charge an employer to administer the benefit and get paid that way, that's okay with us. But Hint Connect is not paying brokers to distribute the product. We're happy to take some more questions if any of them come through now. But I just want to put it out there, G and I are available. Lauren, also, as part of the accelerator, do you want to just give a quick plug about the employer playbook and the accelerator courses that may be designed to help teach DPCs about how to work with employers?
Yeah, absolutely. I think, well, first of all, thanks, because I'm learning all about this right alongside you guys, like forever in my beginner status, right? And I think the most exciting part is what your colleagues want to charge. So when you're looking at the art of negotiation from a employer perspective, you already know the numbers. There's not a whole lot of back and forth, right? And so I would encourage you, if you haven't already, to check out under your support tab, there's a playbook tab, and we've created a DPC for small businesses kind of outreach and strategy. And I think it will give you a lot of foundational work and tools that you need to consider as you're looking to work with affiliate networks as well as larger employers so that you have your pricing ready, your deliverables ready, and you're thinking about your workflows for your clinics. Now, utilization is going to be different and you may want to have different communication pathways. And so I would encourage you to check out the lessons in the accelerator so that as you get involved and you've got this nice influx of patients coming in, you're not like bursting at the seams, you're really setting yourself up for success. And so I'm going to drop the link to the playbook in the chat for you all to check it out. There's several lessons that will accompany that playbook to kind of give you the framework from an operational perspective that you might want to consider as you're thinking about working with larger employers as well.
Awesome. Thanks, Lauren. So we will share the link to the playbook, the link to the DPC trends report, this presentation after this meeting. We are beth.holmes@hint.com or gji@hint.com, or you can reach us at networkdev@hint.com. There's pretty much no way you can't get in touch with us. I'm on LinkedIn, happy to be friends with you there. So please feel free to reach out with any questions you have. We're really glad you were all able to make it today. John, thank you so much for spending your time to be with us. We're really excited to have you as part of Hint Connect. And G and Lauren, thank you for joining as well. I appreciate the support here.
Thank you.
All right, have a good one, everyone. Thank you.
Thank you.